Good afternoon, everyone. Welcome to all of you that are joining us here today, and then those of us who are joining via Zoom, and those who will get to see the recording later on. We're so happy that you're here with us today. And in my capacity as Interim Dean of the College of Health and Human Sciences at Florida State University, it is my distinct honor and privilege to introduce Dr. Deirdra Chester to you today. Dr. Chester, she's the Division Director of the Division of Nutrition, Institute of Food Safety and Nutrition within the U.S. Department of Agriculture. Now, prior to her current role, she served as Agency Science Advisor for the USDA Animal and Plant Health Inspection Service, and was also the National Program Leader for Applied Nutrition Research. She is a two-time graduate of the FSU College of Health and Human Sciences, and she is also a past recipient of the college's Circle of Excellence Alumni Award. Having spent some time with Dr. Chester in Baltimore earlier this fall and throughout most of today, actually, I can tell you that she is a true Seminole, and we are so proud of her many accomplishments. We are so excited to have her here today to speak about the USDA's funded research, applying for USDA funded grants, and how FSU constituents may better position themselves to compete for USDA funding. Please join me in giving a hearty Seminole welcome to Dr. Deirdra Chester.
Thank you so much. Hi, everyone. So the best thing about this is that I know I'm speaking to family, my FSU family. And so it's really nice to be here today. So of course, I bring you greetings from USDA. I will give you, as I go through, you'll kind of see where we sit within USDA so that you'll have a good sense of why we are funding research outside instead of our internal or intramural research funding. So we always do a non-discrimination statement, and you can just read over this. You don't have to read the whole thing, it just means we don't discriminate at USDA. So I want to give you just a look at our NIFA nutrition team. We are in the Institute of Food Safety and Nutrition. My supervisor is Suzanne Saluka. She is the Deputy Director of the Institute of Food Safety and Nutrition. And for the next 4 months, while she is on parental leave, I am serving in the acting role. And so this is our nutrition team. These are folks that you want to be familiar with. And the reason I say that is as I go through our funding, your first line of contact to USDA as it relates to receiving funding is the national program leaders. And so we have in our institute 5 national program leaders. We have Helen Chipman, Pascal Jean, Lisa Jans, Lydia Kame, and also Mallory King. Those are the individuals that are responsible for all of the programming in our agency. I have some very nice ties to some of these folks. So Pascal Jean, I just hired her in August, but she likes to tell people that I was her teacher. And she says it exactly like that. When I was at FIU working on my Ph.D., I taught the class that prepared students for the dietetic internship, and she was in that class. And so about 5 years ago, she came to USDA as a program specialist. And then she went over to our sister agency, Food and Nutrition Service, and came back. So now I'm able to just continue the mentorship in her role as national program leader. And then one of our other national program leaders is Mallory Canings. And so about 7 years ago, I hired her as a program specialist, and now she's a national program leader. These are individuals that, you know, don't feel shy to reach out to them and call them. Anytime you're looking at our portfolio of funding, there's a national program leader. I know that some funding agencies, you know, they have this myth like, no, you don't call them. You actually call them. They have the answers. Their job is to make sure that you have all the information that you need to be successful as an applicant. So I encourage you to call them. So the overview of NIFA, I'll talk briefly. So the National Institute of Food and Agriculture is the extramural science funding agency within USDA's research, education, and economics mission area. So within USDA, we are broken up into mission areas. NIFA falls under the mission area of research, education, and economics. We also have the Agricultural Research Service, where I was a scientist for 9 years, and that is our intramural. Those are scientists that are internal. They receive federal dollars to carry out research. And then what we do at NIFA is we push all of our dollars out to colleges and universities. And then we invest in support initiatives that ensure the long-term viability of agriculture. And so a lot of times when we talk about the fact that we fund agricultural research, people don't see themselves in it. So sometimes nutrition, food science, they don't see themselves in it. But for us, food science, nutrition is along the continuum of agriculture. So I think that's the first barrier, is just to make sure that you see what you do fitting into agriculture. We also provide funding and strategic leadership for programs that ensure groundbreaking discoveries in agriculture-related sciences and technologies. We make sure that it reaches the people. One of the things that is different from USDA NIFA than say NIH or the National Science Foundation or any of the other CDC, other funding agencies, is that we incorporate extension into our funding. And so extension means that we not only fund the research, but our expectation is that that research hits the ground and it helps people in communities across the country. Now we have a lot of topics that are covered. We have food science, there's education, but there's also animals. So animal research is here. Plant research, so there's a program that I'll talk about today, foundational knowledge of plants, and you'll see that fits very well into the College of Health and Human Sciences. So where does NIFA fit within USDA? So I talked a little bit about NIFA and where we fit. So our Secretary of Agriculture is Tom Vilsack, and I talked about those mission areas. So if you look at this, you'll see that our mission area is where we have that little arrow, and that is research, education, and economics. Our undersecretary, we just got a permanent undersecretary, Dr. Shavonda Jacobs-Young is our undersecretary. The one thing that I like about having her as an undersecretary is because she started at NIFA. And she started at NIFA. She was a national program leader. She was once the acting director of the National Institute of Food and Agriculture. And then she went on to lead the Agricultural Research Service. What is so monumental about her leading the Agricultural Research Service is that she is the first person of color, and she is also the first woman that has ever led the Agricultural Research Service. I would go into the building, our main building, and I would walk down the hall and peek into her suite because it was amazing to see the picture. There's like 18 white men, and then it's a woman of color. And I would just be like, oh my gosh, this is monumental. And so, you're talking about 3,600 scientists that are in the Agricultural Research Service. And that so many years went by where there was not even a thought of a female or a person of color leading that agency. And so I just thought it was amazing. I still think it's amazing. And I just think that it's a step in the right direction. Even though we lost her as the undersecretary, she still is influencing our agencies that fall under research, education, and economics. So NIFA, I'm not sure if you guys know about what happened to NIFA, but in 2019, our agency was told that we needed to leave the Washington, D.C. area, and we had 60 days to relocate to Kansas City. So you can imagine what effect that had on families. And so we lost more than 75% of our scientists at that time. And the agency was moved to Kansas City. But what I am proud to say is I just came back to NIFA in May as a division director of nutrition. We are getting a lot of our institutional knowledge that's coming back to the agency, and we now have 330 employees. that are at NIFA. So what you will see is you'll see that there are more national program leaders. So as you have questions about the programs that we fund, there are actually people there that are picking up the phone and can respond to those questions. Our budget has increased to $2.4 billion across the agency, up from about $1.9 billion in the last fiscal year in FY21. So we have additional funds. The main flagship program that I'll talk about has increased from about $250 million to $475 million. So that is something that we can be proud of. We are getting more funding. So it means that we'll be able to give more funding out to individuals at universities. Now I show this picture because it's a snapshot of the land-grant university system. And I want to show this because I think what actually happens is there's a myth. Some folks think, oh, you know, NIFA, they only fund land-grant universities, but that's not true. We fund land-grant universities. We fund colleges and universities, any college and university. We also fund nonprofits, individuals, corporations, industry. So what you will see is that whenever you look at all of our requests for application, you'll see that there's eligibility in each one of those. And so if you're not sure if you're eligible, I encourage you to reach out to the national program leader because they'll be able to help you navigate whether you are eligible for a particular program area priority. So for our competitive grants, what we have is, I'll talk to you about the competitive grants. We do have a portfolio that's capacity. It basically means that Congress says you must fund these things. So there are programs like FNAP, the Expanded Food Nutrition Education Program, but Hatch funding, those different things. But for the competitive, we have 4 institutes, and in the Institute of Food Safety and Nutrition, where I am, we have 6 funding opportunities that are related to our flagship program, the Agricultural Food Research Initiative. And so that is really where you want to look. But I will talk a little bit about those non-AFRIC programs, because some of those non-AFRIC programs you are eligible to apply to, and also you can always partner. Our eligibility really stipulates who the lead on a particular grant is going to be. So there may be something that's open to nonprofits, and it's about nutrition security in communities, but it doesn't mean that you can't partner with a nonprofit in your community to receive those research dollars as a co-applicant. So our project types. So we fund what we consider integrated research. When we say integrated research, what we mean is that these are programs that require at least 2 of the function areas. And our function areas are research. We fund research, and it really is to support fundamental and applied research in a particular discipline. But we also support education programs. I'm going to present like pre-doctoral, postdoctoral programs so that you kind of get a sense of what we fund in those areas. And then we fund extension. Extension is outreach. That's how we look at it. It means, what is the research? How are you getting it out to the people in the community? And so you'll whenever you look at our funding opportunities, it will say this is a research only, or it needs to be integrated. That lets you know whether you need more than one of those function areas. So our project types, I want to talk a little bit about this because there are standard projects or that you can apply for. And those standard projects are really those ones that are either research, education, extension, or a combination of those. But then we have strengthening. Our strengthening are really to build capacity in the research community. And so under strengthening, we may have a project that is a sabbatical where you can go to another university, or you can take your time off. But you can also apply for something like a conference grant. So you have an idea and you want to bring some researchers together and you want to talk about it. We fund that up to $50,000. And then we have what are called phase grants. So those are small to mid-sized universities, minority serving institutions, and also F-score. So those states that are the lowest funded in any particular year. So you always want to look at those different opportunities, because if Florida, which Florida is never, I think I've been with NIFA for 10 years, and Florida is never on the bottom when it comes to how well funded the state is across all of the universities. So they really make the cut, but just make sure that you're looking every year just to see if there's an opportunity for you to apply for those. So now is the good stuff. I call this the good stuff because this is what you probably came to hear. So what is available in the area of food safety, nutrition, and health? And that's our overarching program area priority. So there are 3 programs that I'll talk about that are nutrition related. 2 of them that I'll talk about are food science related. And so there are 4 of them, but I thought 2 of them were more responsive to the type of work that you were doing here. And so remember, there are so many more than just this. So the good thing is I'll explain to you a little bit about how AFRI works. So we have 3 different RFAs. We kind of got it together and we said, people don't need to look 100 places for this. They need to be directed in 3 different places. The first one is the AFRI Foundational and Applied Sciences RFA. All of these that I'm presenting today appear in that RFA, along with all of the other 6 areas that we fund related to applied and foundational research. And then there's the AFRI SAS, Sustainable Agricultural Systems RFA. Those are big grants. They're $10 million grants. Over the years, we have funded more in the area of nutrition. And so I'm very happy that we are funding more. It means that people are applying. And it's $10 million over 5 years. So that's a pretty good grant. And then the third one we have is the AFRI Education and Workforce Development, pre-doctoral, postdoctoral. You're a professor and you say, I want to write a grant and I want to support students in our department and I want to give them a stipend. We have grants that do that. And so it would be the professor as the applicant. And so the others are, just kind of like a professor that wants to apply for something, but you as a professor can apply for something to support. For the pre-doctoral and postdoctoral, the actual doctoral candidate is the PD. Now, the one thing about that, I get this question all the time. Because the pre-doctoral and postdoctoral, our goal is really to support those students. They can actually take that money. So it means that they can apply at your university and they can say, oh, I changed my mind. I want to go to that other school, Lord forbid. But if they do that, they can take the money. So I always say, whenever you get someone that gets a pre-doctoral or postdoctoral award, you want to be real nice to them. Make sure that they have nice facilities, because you want them to stay because it is their grant and they can take it with them. So the first one is the Food and Human Health. Many of these programs, a couple years ago when I was still at NIFA, what we did is we really started to go out and ask our stakeholders if our portfolio was responsive to the work that they were doing. And we got a lot of feedback from them saying, no, it's not responsive. This is what you should be funding. We overhauled our entire food safety, nutrition, and health portfolio to be responsive to stakeholders. When I say stakeholders, it's going to professional society meetings, everyone that's there. You as a researcher, you can send me an email tomorrow and say, Deirdra, this is the kind of research that I do and I don't see it in your portfolio. If it fits broadly in our portfolio, we would work to get that into our program area priority. So these were overhauled. So this one is called Food and Human Health. And the nice thing that we did also, these used to be up to 400,000 and they went up to 500,000. We now have them up to $650,000, which is a pretty good chunk of money. And it's 3 to 5 years. So if your project takes 3 years and you want the whole $650,000, that's how you write it. You could get that full amount for 3 years. And so the grant types, that's the part that I was telling you that you want to look at very closely. This tells you all of the grant types that we allow, but also the project type. This is research only. Pretty much means that anyone can apply for this, even an individual. You got an autoclave in your house, you can apply for this, and we would send the money to you. And so this is closed. Most of the ones that I will talk to you about are closed right now, but in December and January, you'll see these start rolling out again. So make sure that you just pay attention to that. And so this is really to investigate the nutrients and contaminants in food and their impact on the gut microbiome. So microbiome work, you know, everyone's talking about microbiome work. You know, I kind of laugh because a couple of years ago, I started a program with NIDDK at NIH, and we started to fund, we funded $140 million in about 7 years, being able to come together and fund research. And what I think is so interesting is that I think even today, if we sat at the table and we said, so what do we mean by microbiome? Because really, you as the researcher get to tell us what you mean by microbiome. We don't have, you know, it's gut health pretty much. So if you're doing research in gut health, you can submit to this portfolio, and it doesn't necessarily, you know, we have those seed grants. So I do want to tell you to apply for those seed grants so that you can collect preliminary data. That's the one thing that you need to get to those big dollar amount projects, is to collect some preliminary data. So we have a mechanism for that. And so this one, the national program leader is Dr. Pascal Jean. She's available for any questions that you have related to this program. So the next one is diet, nutrition, and the prevention of chronic disease. So the portfolio that I led for many years when I was at NIFA was childhood obesity prevention. That program was sunset. We spent $200 million over a 7-year period. We felt like it was a huge dent in really coming up with some best practices for how programs should be implemented in schools and communities across the United States. And so, you know, I'm one of those people when they said, oh, your program is sunset. And I was like, so what does that mean? And they're like, you don't have any more money. And I was like, that's not right. And so, you know, I'm like, but we still have things to do in the space of childhood obesity prevention. And so we're able to submit perspectives for a program. And so I said, okay, can you give me a little bit of money? Because those projects were $5 million and I funded one $40 million project. And so this was an opportunity to ask for a smaller budget amount, which was $1 million. And so we fund about 5-6 projects a year in this portfolio. It's no longer my portfolio, but it was my baby. And Dr. Mallory King is responsible for this. So it really is looking at those integrated projects. They have to have 2 of the function areas. And it's really to help prevent and manage chronic disease. And with this portfolio, it's not just in children, it's across the gamut. The next one is the foundational knowledge of plant products. And this is a research only program. It actually does not sit in the Division of Nutrition. It's in plant systems. When this program was started, another colleague and I initially wrote this program. He said, oh, I need some nutrition, you know, background so that we can do this program. And so the reason that we kind of came up with this is that we were looking at plants, but also looking at the nutrition value in some of those plants. So this is a program that is very responsive to some of the work that you do, but it's the foundational knowledge of plant products. And so it's the same $650,000. It's research only, so you don't have to have more than one function area. And then the person that leads, it's 2 people in plant systems, Victoria Finkenstadt, and then also Vance Owens. Those are the individuals that you want to reach out to if you're interested in this program. So I'm going to switch a little because I want to talk about food safety. I remember when I first came to NIFA, I said, why don't we call it food science? They're like, because we call it food safety. I was like, but is it really? Because it sort of sounds like food science. So we use food safety and food science interchangeably. across our programs, because many of these programs are responsive to food science, and we have funded researchers in food science at FSU in this portfolio. So this particular one is food safety and defense. It's led by Dr. Mark Carter, and it's basic and applied research that will reduce the risk of intentional or unintentional contaminants of food. And so what I would encourage you to do is kind of look at this RFA if you're in food science. There are about 4 programs that you really want to pay attention to, and then reach out to those national program leaders. One of the folks that came back around the same time that I came back to NIFA is Dr. Jody Williams. She will take this program over next year, and she is amazing. We laugh because, first of all, Jody looks 12, and sometimes we're talking about, how long have you been at NIFA? And she's like, I've been there since for 28 years. And so people are standing there, they're like, what? It's because she started when she was 16. So she was a student when she started, and she was an 1890 scholar, and she got her Ph.D. in food science from Virginia Tech. And so she has risen through the ranks, and she's a national program leader in food science, a brilliant national program leader. And so the other program is Novel Foods and Innovative Manufacturing Technologies. This is ran by Dr. Hongda Chen. But the priority focuses on the research that develops risk-based approaches to ensure the quality, safety, and nutrition of novel foods and food ingredients, including products from pulses. So this is very responsive. If you are in the College of Health and Human Sciences, one of the things that you want to do, we talked about it a little bit today, about what are funding agencies looking at. They're looking at collaborative projects. So they're actually waiting, like if one person says, I'm going to submit this proposal, but then another person submits it and it has a nutrition department and it has a food science department, that actually is what they would consider a more innovative project. So you want to remember that those are things that reviewers are paying attention to. So anytime you can reach across the aisle to another department and bring them in, that is something that actually helps in the review process. You probably won't hear that all the time, but that is really a focus, not only at USDA, but also at NIH, at NSF. They just want it. It's interesting because I always look at it and I say, oh, they want more bang for their buck, but you're adding more people to it. But what you're doing is you're doing better science, and it just strengthens the preliminary research for the next iteration of what you're putting forth. And so if you look at it that way, it won't seem like your colleges are getting all of the money or your department is getting all of the money. So we have some non-AFRI food safety, nutrition, and health programs. These programs, over the last couple years with the American Rescue Plan Act, I came back, they said, Deirdra, come back as Division Director of Nutrition. I said, okay, because I was a national program leader. I know how much money is there. I know the workload. And then I come back and they're like, so you got $50 million more that you need to spend this year. And then they say you have $20 million more that you have to spend this year. I said, okay, that workload is really changing. I mean, that's really good because we have been able in these non-AFRI programs, we've actually got a huge influx of money. So we have the GusNIP program, which is the Gus Schumacher Nutrition Incentive Program. We have the Food and Agriculture Service Learning Program and the Community Food Projects Competitive Grants Program. I talk about these programs because one of them is open to colleges and universities. 2 are open to nonprofits, but this is really an opportunity. These are high dollar projects, so as I go through, you'll say, oh, wow, that's a lot of money. And so it might be worth it to partner with a nonprofit in the area. Most of these really look at, so the GusNIP project is a very innovative project. It's one that looks at purchasing fresh fruits and vegetables by low-income people. And what it is you're in the community, you're writing up projects where you're doing like double up bucks. So you're really thinking about the food needs or nutrition security of your neighborhoods, of your communities, and how to get more fruits and vegetables in those hands. In a dietetics world or in a nutrition world, that's really a great opportunity. When you think about community nutrition, it's a great partnership where you could help with these types of projects. So these projects are pilot projects where they're $100,000, they're standard projects that are $500,000, and they're large scale, which are greater than 500. When you're in the research world, greater than 500 is whatever it needs to be. I mean, one of these projects was funded at the tune of like $14 million. So you think about you partnering with someone where you're doing that kind of work in a community, and $14 million is a lot of money. And then we have like a produce prescription program. It's basically working with healthcare partners. This is a College of Medicine. You could actually be a partner on that grant, where you're actually writing prescriptions for people to receive more fruits and vegetables. There are people in the nonprofit world that are seeking out a College of Medicine because they need a healthcare partner, or they're seeking out a hospital because they need them to make this grant happen. And then it's also, we have a training technical assistant. With many of these, we have these technical assistants. We paid about, there was a grant for $27 million for technical assistance. It is a university that says we can provide technical assistance. We can help these folks write a better grant. We can put partners together. And so the government actually said for many of these grants, they need technical assistance because they're small nonprofits. They don't have someone that they can submit human subjects applications to. And so that's where the technical assistance part comes in. The next one is the Community Foods Project. Very similar. It's to fight food insecurity and really to create a sustainable food system. And so this is another one that you want to look at. And this would be partnering with nonprofits in your area that are doing this type of work. These are really getting at our goal in the federal government of making sure that all Americans have access to safe, healthy food. The last one, which a university could apply for, is the Food and Agricultural Service Learning Program. And it really is to increase the knowledge of agricultural science and improve the health of children. And so this is one that would fit perfectly in the College of Health and Human Sciences, because it's a grant where you would actually be making sure that you're increasing the access of school food to school kids. And so you may have a project or a professor that's working in this area. I would definitely encourage you to apply to this project. So this is the good stuff. For the students in the room, this is when I light up and get all excited, because this is about supporting the next generation of scientists. It's so funny. I was somewhere speaking and I said, because I'm about to retire, I'm not going to work forever. And I said, I'm old enough to say I'm about to retire. So I think that it is definitely my role to make sure that you know about these programs, because one of the things that we want to do is we want to make sure that you have free college, especially at the pre-doctoral level, and then a postdoc. You want to be able to fund that on your own. So the first one, the research and extension experiences for undergraduates. This one is the one that is open to professors in departments. And really it is to provide undergraduate students with experiential learning opportunities that include significant research and or extension components in the food and agricultural sciences. That is very broad. It basically means that you're sitting in any college at Florida State and you say, you know what? I think that we can do outreach, and I think that we have a research experience, and it can be related to food and agricultural sciences. And what I want to do is I want to get money so that I can support students to have that experiential learning experience. I remember presenting on this a couple of years back, and someone was like, I had no idea that you guys had money for that. Yes, we have money for that. So this actually sits in the Institute of Youth, Family, and Community. This comes out of the Education and Workforce Development, RFA. So it's all of our research that we're funding to really increase, we want a diverse workforce, but it's open to everyone that is in a nutrition or food and nutrition program. And it doesn't have to be program specific. It's what are you doing? Are you increasing or are you giving students an experiential experience in food and agricultural sciences? So the pre-doctoral fellowship, I was like, man, I didn't know about this. I wish I had $180,000 for up to 3 years that goes to you, the student. So these are students who are in the stage of conducting their dissertation and research. And we know that you are heading to a terminal degree. And so they're limited to a total of $60,000 a year for your, that is for the whole thing. And so what we did a couple of years ago is that we had these pre-doctoral and postdoctoral fellowships, and we were very prescriptive. You can only use this much for research. You can use this much for salary. You can use this much for international travel. And what we got from people that were awarded those grants is they were like, well, my college gives me travel, or my college gave me half of my salary. And so it was just money down the drain. We were getting money returned to NIFA because we were saying it has to be used. So we went back to the drawing board and we said, you know what we should do, we should give them the money. We should let them come up with a plan of how they expect to use it, because they may actually be supported by their institution in some way. And so that's why now it's $60,000 a year. And what I like is that they don't necessarily do indirects on these. So, colleges aren't necessarily happy about that. But I mean, I would just say, but just think, you're supporting the students. And so there are a lot of things that are in here for you to have, you can go out of the country to an international meeting that's not restricted. So all of those things that you think you need to be successful as a pre-doctoral student are included in here. Now, this just closed, so it means that the application deadline will be next year, similar. Yes. 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 So we have, I say that there are two models. Within nutrition, we had a couple people, this actually came up, but what we were very clear of is that student take what they're doing and they can write up what they are doing. What we always tell them is just to make sure that they identify that it's part of your grant, so that when someone is reviewing it, because we've gone from, they used to all be reviewed in the Institute of Youth, Family, and Community. And I was like, why? Those are not the people that we need to review it. So now what actually happens, all of those pre-doctoral and postdoctoral fellowship grants come in, and then we distribute them to the area. So within my unit, food and human health may get one. Diet, nutrition, and chronic disease might get 2 or 3. And so what happens is it has really increased the fact that they get a much better review. But it also means that if someone is on that committee and they funded you last year, they'll say, hey, this looks very similar to Dr. Salazar's research. And so you do want to make sure that you identify in there. And it will probably be identified because they're more than likely, they have to have a mentor. They're going to list you as their mentor. And so what will happen is, as they list you as their mentor, it won't be like, oh, they copied their research. So yes, they can actually go hand in hand. Yeah. So the postdoctoral fellowship program, this is like awesome. I'll tell you, I was a postdoc. I did not get this much for my postdoc. I mean, I was a McKnight fellow, but I think on paper, it didn't look like $225,000 over 2 years. So with our postdoctoral fellowship program, it really is to develop new scientists and professionals to enter research, education, and extension fields within the food and agricultural sciences. It can be private sector, it can be government or academia. What we really want is we want to know that these individuals are being adequately trained. And we think it's important that as we train them, they may go to academia, but they also may go to the Agricultural Research Service, and we'll capitalize on that. And so the budget is $225,000 for project periods of up to 2 years. And the funds must be requested primarily for salary or stipend, and it must be primarily justified. So there is some funding in there. When you go to the RFA, you will see all the different areas. You can have some of the money to support your research. What's nice about this is that, you know, you could say, okay, 225,000, that's roughly $100,000, a little more a year. And so I laugh because when we look at these postdoctoral fellowships, sometimes I'm like, they're being paid more than an assistant professor. Like, that is like, really? But you could. So, you know, you kind of look at that and you're like, okay, that's really supporting that person. But it's also supporting them so that they don't have to worry about all the things that come with being a postdoc, and they can really focus on their research. It's supposed to be a program that gives you a head start. You do a really good project, you get a lot of preliminary data, and then we hope that you roll right into applying for one of those projects that you're funded at $650,000 a year. And so that is what my hope is for individuals that apply. I'm so glad that we're getting more nutrition projects that are funded and more food safety projects that are funded in this area. But it really is because if I come out and talk to you about it, you're gonna call Dr. Alley and you're gonna ask him 100 questions. Call him and ask him 100 questions. You have all the way probably up until September of next year to ask all the questions, get your project solidified. So for all of these, and what I'll say is that, like, I won't stand up and say, yes, definitely this will be a program area priority next year. But what I can say is that there's a 99% chance that it's going to be a program area priority without a lot of tweaks. So what I would do for all of these that have already closed, I really encourage you to go to the request for application to look at the program area priorities, and you actually have a head start in getting your project started for submission next year. So yes. Mm-hmm. They will not. And the reason they would not is because it's the timing of when you have to be advanced to candidacy. But where that is a very good question, because where you want to look for something like that is you want to look for like a seed grant. Any of our grants that support you collecting preliminary data. So you could actually apply for one of the seed grants, and you could get a smaller amount to collect preliminary data. And that's usually where we see that someone says, I've been doing this for so many years and I want to try something else, but I need money so that I can try something else. So definitely, whatever area you're interested in, speak to that national program leader, because they can tell you based on all of the different grant types where they think something like that would fit. So that's an excellent question. Thank you. So I will make sure that this slide is available because there are so many resources. Our website is getting better. Everyone knows that the government doesn't usually do a great job with websites, but we have hired some very, very talented people to help us with that. And so it's a lot better than it was a couple years ago. So there's information on all of our funding opportunities, but our grant resources, our policy guide that really talks about all of the statutory and regulatory responsibilities for the NIFA grants, but our grants application page. And then this is the first time, they didn't do this before. I love this. We actually have a NIFA National Program Leader. So the page, and on that page, it lists all the national program leaders and their areas of expertise in the areas that they're funding. And so that is so important, because when you go to that page, you know, you can reach out and say, oh, I looked at this and I'm not sure if my research idea fits, but I think it does because it says that that's your area. So can you point me to the request for application where I should focus my time? And then, you know, also a guide for preparation and submission of NIFA applications. So all of that is very important. You know, one of the questions that I asked the Dean Andrews today is, I said, what is your support in the college for folks that are applying? And so I was happy to find out that there is some support. And so, you know, I just want to implore you to make sure that you take advantage of that, and you know, that you take advantage of all the resources. One of the things that I'll say, you know, I was a national program leader for many years, and I could probably kind of like go down the list of issues that people have. And I think sometimes it's crushing. I actually had someone from a sponsored program office call me, and she was in tears. And I was like, what's wrong? She goes, the application was rejected because I forgot to put the document in a PDF form. And she said, oh my gosh, is there anything? And you know, it's hard, because I had to say, unfortunately, there's nothing that I can do, because we are held to whatever comes through grants.gov and to our system is what we have to accept. If there's a critical document missing, unfortunately, I can't accept your application, and you can't send it to me on the back end. And so, you know, I mean, I would imagine that this lady was probably like on the brink of having a heart attack, because she said, I don't know who's going to call and tell me. Like, and so, you know, as the national program leader, it was my responsibility to, and I think she noticed it in just going through things. And so she was calling ahead. And so, of course, I had to bear the news, because I had to be the one to send out the email that says, unfortunately, your application will not be reviewed because documents were missing. And, you know, those are very, very hard things to do. But one of the things that I always say is that you as a researcher have an opportunity to really circumvent any issues like that that happen. I always tell people, if you know that you have Word documents, convert them all to PDF. Whether you're applying to NIH, NSF, USDA, CDC, you have to have PDF documents. The system does not read any Word documents. So I say, make sure you do that. And also, when you're doing that 18-page narrative, sometimes when it converts to a PDF, it becomes 20 pages. So that's out. It's over the page limit. So you want to make sure that you do all the work that you can up front to say, here is everything. It's in the right format. You can look at this version. If you have any edits, let me know. I'll send you an updated PDF. So you just want to make sure that, and I think a lot of times people, their perception is that as the national program leader, like they are like, you're all powerful. And I'm like, not really, not all powerful. Like there are some rules. So I have my eyeglass case. I have this. So my eyeglass case. So when I'm on a call and, you know, we're having a discussion and someone is talking about, yeah, well, can we do this? And I was like, I don't look good in orange and I don't wear silver bangles. And they're like, what? I'm like, I don't like jail. So, you know, I always say that because remember, your national program leader does not want to go to jail. They want to help you as much as they can, but please help keep them out of jail. And so what you can do is do all those things up front that really puts your application in, you know, in the, you know, you want to put it so that it has a chance, a fighting chance. The other thing that this one is the one, panelist information, serving on a panel. Serving on a panel, I'm telling you, this is the best way to know what happens in the panel deliberations, you know, what kind of questions are asked. I have people, I lose panelists because, you know, I say, you should serve on a panel so that you can figure out what's happening. And they come and they serve on a panel and they get it. And then they don't come back the next year. But they apply and they're successful. And, I get all these notes where they're like, you know what, you are right. You know what kind of questions are being asked. I tell people all the time that a grant application is a story. Every person on panel that is reviewing applications, they get anywhere from 12 to 15 applications. We've done better. When I was serving back in the day as a federal government employee, not being compensated, we got like 17 to 21. So, they got 12 to 15 applications. They read the first one, it's not a good story. I'll save that one for last. They go to the second one, it's okay, but I'm confused. They go to the third one, it's compelling. That third one, that's compelling. Now, all the ones after get compared to that. You don't ever want to be the application that they put down because it's not a compelling story. They don't understand what you're doing. You want to be the one that they cannot sit down. So, they are not necessarily comparing them across, but it's hard. If I pick up one that just draws me in and I know exactly what they're doing and they told it in a way I don't have any questions after I read it, that's the application that you want to be. And what I always say is where people, a lot of times as scientists, we don't always feel comfortable sharing our research ideas with others, but let your spouse read it. Let your sister read it. Let your brother read it, because you want that lay person to read it also, because they're like, I don't know what you're talking about. They're like, I'm not a scientist, but this is bigger than that. Like, I don't know what you're talking about. Like, it's here and it's there and it's over here. So you want someone else to look at that application because you want it to be a compelling story. And you want to serve on panel. You can do this QR code, or you can email me. I'm really good at getting people on panel. And what it is I just send it to my national program leaders. I'm like, I met this person. We need to get them on panel. I think they're good scientists, and I really think that we need their perspective on panel. So just remember that it's as easy as that to serve on a panel at USDA. We are very, very, very committed to making sure that we have diverse panels. Our diversity is also across levels. So a junior researcher, a mid-career, and also a researcher that has been there a long time. I am a firm believer and have seen over the years, when you've been a national program leader for 10 years, you see the difference that a diverse panel, when you have a diverse panel, you have a diverse set of applicants, awardees from that particular panel, because there's someone who is junior that's saying, this is a junior researcher and it's a really good proposal, and I think we should fund it, because we do a ranking system. So you definitely want to serve on panel. And then the last thing is just really a big thank you. Today has been such an amazing day. I spent time at the Dean's Advisory Council, which I'm so honored to be a part of the council, but also just riding around campus, knowing that I'm not going to tell y'all how long ago, because I'm only 25, that I was walking around campus. And, actually, I will tell you, I cannot believe it has been 30 years since I first came to this campus. And I was a junior at that time. But just knowing that I walked around this campus and I'm able to come back and I'm able to tell you about funding opportunities for USDA and really encourage you. I want years from now to say, I came to FSU. They understood the assignment. They started applying more. They started getting more predoctoral and postdoctoral fellowships awarded to the university. I think that is the thing that would make me very proud. I am definitely proud to me. So thank you so much for your attention. Questions? Yes, yes. I learned about that this morning. I think that's awesome. Yes. Are there any questions at all? Yes. Yes. Yeah, so we talked a little bit about IACUC, and over the years, what we've just seen is that people aren't applying because they think that they have to be already approved. Well, what actually happens is you have to apply. And I know that some universities are taking a longer time period to review those, but what we do is you come into the panel, your proposal comes in, it's reviewed. If it's meritorious, we move it forward for funding. And then what we actually do is we withhold funds. So everyone knows that if you write a 5-year project, you probably will not be working with human subjects or animals until about a year in. You're doing some preliminary work, set up the project. So if you apply and get funded, we just say, okay, we're going to withhold $400,000 of that $650,000 until you get approval. So just know you don't want that to be a barrier for applying. And it's interesting because what I have noticed over the years is that if I send you a letter and I say, hey, you've been recommended for funding, and then you call your sponsor program, they're like, what? Yeah, $650,000. They're like, let us convene a panel right now so we can review this. So, you know, it kind of works. You know, I have probably been talking about this, you know, I'm a very spiritual person, and I believe that everything happens exactly when it is supposed to happen. So I am a true believer that you write that grant, you submit it, it's recommended for funding, that the universe will give you everything that you need for that funding to happen. So it'll be magically approved. That's just my thoughts. My 2 cents. Yes, you had a question. No. You just said, send me your name. I will, and tell me your area of expertise. And then what I'll do is I'll send it to the national program leader. They'll ask you, if you want to send the bio sketch with it, you can. And they'll probably ask you for the bio sketch. They'll ask you your area of expertise. They'll tell you some panels that they have upcoming that you can serve on. Yes. No, don't say that. He's not too busy. Okay, so let me set it up. He's busy. I know he's busy, but he'll do this, and then next year he'll write one of those proposals that gets accepted. Okay. Oh, okay. So, you know, that single food was in my old program. And I thought we had clarified in food and human health that it was not just single food. So if you would, could you send me that comment? Send me also your grant number. I would just like for one of the national program leaders just to look at it. Yeah. And then I want you to reach out to that national program leader and say, hey, I'm submitting this again as a resubmission. Okay. Yes. Yeah. Okay. You're welcome. Anyone else? I see your hand. Are you asking? You look, no. You look like you want to ask a question. No, unfortunately not. I know we get folks that ask that all the time. And it's really because we sit in on the review process. So yeah, we cannot. Okay, you guys back there, someone had a question. No, you're like, oh, okay. All right. Well, if there are no other questions, thank you so much for spending time with me this afternoon. It has been a pleasure.
Thanks again, Dr. Chester. We're so grateful for you and grateful for the time and expertise that you provided for us today. For everyone here, we do have some refreshments out in the hall. We were talking about rules and regulations earlier. The College of Medicine Dean was gracious enough to lend this space to us. But he said, no food or drinks. So I don't want to be wearing orange or thrown into jail for anything. So, but if you'd like to speak to Dr. Chester and ask some more questions with her, or just about her time as a Seminole, I'm sure she'd be more than happy to speak with you there. But thank you so much and hope you all have a great weekend. Let's go Noles.
Feel all spoiled. I don't want to go back to work now. To our IT stuff.